Rhexis is an important step in cataract surgery, and learning capsular Rhexis is not only important, it is important to master it. So here in this topic, I'll be briefly giving some tips about how to go about and master in different scenarios. Shearing is the principle of doing a Rhexis, not tearing. So you can actually make a good Rhexis if you use a shearing force, holding the flap on itself and then pulling it circumferentially and towards the center. First and foremost is a good visualization. If you do not have a good red glow, it is important to stain the entire capsule with trypan blue and then initiate the Rhexis. You can do a Rhexis either with a cystoscope or use a forceps to do the Rhexis. But all that is important is to do and complete a Rhexis. If you have a good red glow, then it is more easier. So choose your cataract if you are learning CCC properly so that you can do a Rhexis. You see and visualize the flap which is getting folded. Make sure that you are pulling it every quarter, reholding and folding it on itself and completing the Rhexis. Keep your antechamber deep all the time with viscoelastic. If you are not able to see the red glow, then staining and following the pupillary size is important. If you have to understand how to make a size of 5 millimeter, then you have to know what is the pupil size and follow the pupil margin. If you have a Rhexis marker, then it is fine. You can put the Rhexis marker on the cornea, center the Purkinje reflex in the center. Then you have a good spot, good mark on the cornea. And then you follow the corneal mark with the Rhexis marker and complete your Rhexis going along the mark on the cornea. That is a good way and an easy way to make a Rhexis of your desired size and shape. If you have a Varian or any digital marker system, then of course you have the liberty of choosing the size of your Rhexis, whether it is 4 millimeters, 5 millimeters, or up to 8 millimeters. You can choose your size and complete. If you do not have any of those gadgets, it is simply easy to make 4 marks centering around the Purkinje, which is 6 millimeter away with a caliper, and that can also give you a size of 5 millimeter or 6 millimeter. And accordingly, if you do the Rhexis touching upon those 4 points, your Rhexis size will be adequate. Now let's come to some difficult scenarios. First is a mature cataract. It is important to stain the capsule, as I already emphasized. Keep the antechamber deep, formed with high molecular weight viscoelastic, and always try to keep the capsule folded on itself and keep pulling to the center. In an Intumiscent cataract, it's a little more difficult. Use high molecular weight viscoelastic. Aim for a smaller Rhexis. That is important. Anytime you feel the chamber is getting shallow, do not hesitate to refill it and complete your Rhexis. Making a small Rhexis is absolutely fine. After you deterge the capsular bag, you can always enlarge into a bigger Rhexis. In a Morgagnian cataract, deterging is easy by just inserting into the entire capsule a needle, 26 gauge needle, and pulling out the liquid cortex. Then you can complete the Rhexis as such. In a pediatric cataract, the zonules are taut, so capsule can be pulled away. So always aim for a capsule Rhexis which is smaller than what you want, so that at the end you will find the Rhexis has become bigger than what you have desired. So your objective should be have a smaller Rhexis. In a small pupil, if the pupil size is between 4 to 5 millimeters, it is not very difficult. You can just follow the pupil margin and complete your Rhexis. Do not allow the Rhexis to extend much beyond the pupillary margin, so you can have a good Rhexis of 5 millimeter. However, if your pupil is smaller than 4 millimeters, then it is wise to use any pupillary expansion devices, including iris hooks, and do not stretch the pupil to be more than 6 millimeters, so that you can do a 5 millimeter Rhexis. The pupil size should not be more than a 6 millimeter square. Okay, and more overstretching can cause ruptures on the sphincter, so that will make your postoperative appearance bad. If you are having a colobomatous lens, always aim for a Rhexis which will become central later on. So go away from the colobomatous area, make the Rhexis as far as away possible, and give a good rim near the coloboma so that you can pull the bag to the center. In a subluxated cataract, also start the Rhexis towards the coloboma, towards the subluxated area. Use any device to center the bag, and then you can of course complete your Rhexis, so that when you center, it is remaining central. If you have a Rhexis run out, always make sure that you immediately stop and fill it up with viscoelastic and try to retrieve the run out, or else use a scissors and cut it and complete your Rhexis. Thank you.